Hi everybody, we're coming to you from the Ultra G headquarters demo room. And what I want to show you is some exercises that you can do in the early stages of your ACL rehab program. What I want you to do is think about the anti-gravity treadmill not just as a treadmill though. A lot of people get into a swimming pool in the early phase of rehab for the benefits of the body weight support and for the compression they get from the water. And you can get those same benefits from the anti-gravity treadmill, plus you can use it sooner because you don't have to worry about your wounds getting wet. So there's less infection risk, and you can start your way onto some mobility, which will help get rid of swelling, decrease scar tissue, prevent adhesions, and get that knee better. Some of the early exercises that you can do are a hamstring curl, so when you're supported with some body weight assistance, what you have the patient do is lift their leg up, and just kind of move through a comfortable range of motion. You don't have to force it, but what you want to do is encourage mobility. Get that swelling out of the knee, get the tissue moving, prevent any adhesions. What you can do is get them in there at a comfortable body weight support so they don't have to work too hard on the uninvolved side. Do 3 more reps. 3, 2, Okay, next exercise, they can march in place. So now you're going to bring that knee forward. Lift it up again to a comfortable range. So you don't need to force knee flexion, but you want to move where they're comfortable. Okay, and the last exercise is a pendulum exercise, where they can just hold that leg up and just swing it back and forth where it's comfortable. You don't have to use a lot of speed. You don't have to use a lot of muscle activity. But just kind of move where you're comfortable, again, so that you can get that swelling out of the knee. Go ahead and sit that foot down. So hopefully that gives you some ideas of how you can use the anti-gravity treadmill early on in your ACL rehab program. So next, you can also use the anti-gravity treadmill to start some closed kinetic chain activities with your patients post-ACL. What you want to do is find a comfortable body weight for them. In the initial stages, it may be as low as 20%. What I usually do is start at 50 and then move down from there. So you figure out exactly where they're pain-free, and that's the level you want to start at. So once they're at that level, some of the exercises you can do are squats. So we want to have them in a good position here. Feet about shoulders width apart, toes pointing forward. And you want them just go up and down again to a comfortable range. They don't have to go too deep. You want to remind them to sit back a little bit into the shorts. Don't let the knee travel too far forward, and get a comfortable range of motion. The whole point of starting someone in close kinetic chain is you're going to stimulate proprioceptors, you're going to get co-contractions of muscles, you're going to work groups of muscles instead of just isolating one muscle at a time. Much more functional, much safer for that joint. If they're comfortable and they've got the body weight support they want to try doing it in single limb, you can try doing that. So maybe have the person shift over onto their left leg, if that's the ACL side. First testing body weight support. If they're comfortable, you can go up and down. Again, not very deep, so they're just moving at a comfortable range. Imagine if you were in a swimming pool, you were supported by the water in the pool, you can move very comfortably, okay? Not to a very deep range. The goal of this is to increase that loading to the lower extremity, stimulate the proprioceptors, stimulate co-contraction, increase mobility at the knee joint to get rid of swelling. Once they've done that, they can move on to the ankle joint. So feet shoulders width apart, and they're going to go up on their toes. You can work on the calf muscles. The more body weight support, the easier this is going to be for your patient. You can do some with double limb. If that's really easy, they can shift on over to single limb. And then go ahead and put the other foot back down. And the last thing they can do for close kinetic chain is just work on proprioception. So So have the person stand onto the left limb, lift up the right leg and just hold it up. You can practice for time, trying to get up to 30 seconds. If they're comfortable with that, you can have them bring the other leg down a little bit and just swing it out to the side or forward and back. Challenge themselves with a little bit of movement. Nothing too aggressive, no big movements, of course. And then when they're done, they can set the other leg down. If you want to see how that feels, you can always try that on yourself. See what type of stress is put through your knee at 20% body weight. You see, it's not very much. It's a comfortable amount of support for the patient to remove pain from that knee so they can start those closed kinetic chain activities sooner. Okay, one more thing you can do in the early stages of ACL rehab in the anti-gravity treadmill is just get someone in here for gait training. With the body weight support, what you want to do is eliminate pain in that surgical side. So if it's their left knee that had the reconstruction, you have them get in there. They can maybe put more weight on the right side first, and you want to lower body weight, bring them down to 50%, and then have them put their left foot down and slowly lower the weight more until they reach that pain-free level. Once they're pain-free, you can start the person walking at a nice, comfortable speed. It doesn't have to be too fast. Again, we just want to encourage movement at the knee joint. We want to get some circulation there so they're not so stiff, they're not so tight from all the effusion post-op. And what you want to tell the person to do is work on speed first. So if they're comfortable, have them bump up the speed a little bit. They can bring the speed up to work on their step length. What you want to try and do is stretch out the muscles, make sure they're not so stiff. Encourage them to try and get full knee extension at heel strike, initial contact. Okay. As they improve their step length, you'll see that. And try to get them up to a nice, comfortable walking pace. So they can move as they're comfortable. You don't have to force anything. You don't have to be too aggressive. And then once they've got that walking pattern, it's better. You're taking bigger steps. If their knee feels comfortable, you can start taking away the body weight support. So go ahead and bring the body weight up. And then what you're going to do that way is bring them closer to their full body weight. Slowly, as they get closer to full body weight, that gait should become normal as they return to overground walking. So this is a great way to train your post-ACL patients for their gait pattern to get them back to that normal pattern sooner.